right. Welcome one and all. Welcome one and all to another Mikey Live program. I am your host, Mikey Hutchinson, and we are coming to you live from the Spice Isle of the Caribbean, that is Grenada, where we have it all. We have the sand, we have the sea, we have the sun, we have the women, and the men for the ladies. And of course, listen, this is a paradise. But these days we are challenged with COVID-19. It hinders our way of life. And how long that will be the case for, we are not certain. A lot of it has to do with us and how well we cope with the current new normal, COVID-19 and restrictions. Tonight, you will hear about updates from the Ministry of Health, new changes to regulations. There is a community spread of the COVID-19 in Grenada that we'll talk to you about. Health authorities say that they'll be standing by their COVID-19 treatment and discharge protocols at the General Hospital. The Pan American Health Organization advises caution in reopening school. Now, COVID symptoms last a year for many patients, they say. That's according to one study. Oh, and courts hit twice by bandits in one day. And that's in St. Lucia. We'll talk about these and more when we return on tonight's Mikey Live program. We got to remind you the headlines is brought to you through the kind compliments of course, Grenada Limited, Digital Nawasa, Superb Distributors, the Housing Authority of Grenada, Real Value IG Supermarket. Digicel, thank you very much. Folks, before we go further, let me tell you this. About a year ago, Digicel installed what we call fiber optic internet cables to my house. They ran a line about 1,000 meters or so to my house so that I can get that service, which is superior. All right? At that time, there was another internet service that I was using. It was all right, but I needed something a little more solid. When they installed the new system, they said, Mikey, we are going to allow you to keep the system that we are changing out, just in the event that something ever happens to these fiber optic cables, which is unlikely, but things will happen. And if it so happens, then probably you will not be able to do your news. If it happens, you know, truck pass and they throw down lines and all of that, accidents and they throw down lines and all of that. Yes, today, something happened. There's a tree that caused the fiber optic line to break. Called Digicel. It was on the line with Digicel. And there's somebody in my yard. While I'm on the line with Digicel, I'm like, who could it be in my yard? A Digicel agent shows up even while I'm on the phone. Now that's one. Two, they apologized and said, listen, that problem would mean that you'll have to run an entire new line, 1,000 feet. You think about that, an entirely new line. But remember when we left here the last time? We left the other system intact in the event that anything happened, it would not interrupt your program. Here we are tonight, folks. So the original system, the solid system is out. Not any fault of theirs. There's a tree that caused the line to break. And we are now running on our backup system that they left in place just in case something like that happened. And so I want to say thank you. Thank you very much, Digicel, for foreseeing that and for making sure that it doesn't matter what happens, that the people will be able to view their news. And that's the kind of business I like to deal with. Yes? And in addition to that, they still gave me a third system. I still have a third system in case this one goes down. There is still another backup. So there's no way we will be out because of Digicel. That's to let you know. All right? And again, I would like to say thank you very much. I'm saying this to say that when you really need a company to stand by, to stand by you when it comes to your internet, certainly Digicel. Now, folks, we're taking a break and we will come back. And of course, when we come back, it will be real news in Olilililo. And someone sharing the program tonight will receive some free credit. Again, compliments who? Digicel. So let's take that break. We'll be back. And you know, on Fridays, we don't stay too long. Just guess about 20 minutes or something so. And then I'll go back and drink all the beers. We're coming back.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
Let's get tough on breed larceny. It will destroy our economy. Larceny threatens our food security. Can hurt us locally, hurt us globally. To all the buyers, ask for license from all produce sellers. To all the people, 300 for police for them thieving fellas. To all the farmers, please don't steal produce from your brother. Then you sell it to traffickers, hotels and street vendors. Nah man, let's do all we can to stop breed larceny. New vigilance, new laws, and a tough judiciary. Stop Grenada's organized business crime. It's time.
To report breed larceny, call 300.
It's your summer everything loan from the Communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the Communal. Apply today and take advantage of this exciting offer. Visit the nearest Communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach chairs with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's Summer in Every Drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches, and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 14-3114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. NAWASA, committed to meeting customers' needs.
All right, so let's get right into our news for today. Let's talk about a notice that we received from the Inland Revenue. The Inland Revenue Division wishes to remind all that the deadline for property tax payment is Monday, 30th August 2021. Failure to pay by the stipulated deadline would result in a one-off penalty of 20% of the amount owing and 1.5% interest compounded monthly. The public is hereby reminded that payments can be made using any of the following mediums: pay.gov.gd, that is pay.gov.gd, IRD main office on the Carenage, all district revenue offices. All right. Now, in light of the current situation with the rising COVID-19 positive cases, persons are encouraged to use the online payment platform pay.gov.gd. All right. They say that it is simple, safe, and secure. Now, please note that all property owners, except owners with land clarified as agriculture, are obligated by law to pay property tax. Now, there are new changes that we will be expected to live with for the next few weeks or so, as they were announced by the Minister for Health this morning. Some of those changes includes funerals are now going to be from 9 a.m. to 12 noon. And as well, schools will not reopen as expected in the next 2 weeks or so. In addition to that, restaurants and bars are expected to not have persons dining.
We continue to monitor and observe the situation. Cabinet met yesterday and made certain adjustments based on the timelines and the rate of or positivity rate that we are seeing. Those changes are as follows. Restaurants and bars shall move to takeout service only with effect from Saturday, that is tomorrow, with effect from Saturday. Churches are asked to maintain the 6-foot distancing throughout all of their services and gatherings. Similarly, funerals will be between the hours of 9 a.m. and 12 p.m. and should not be longer than 1 hour. Schools, which were scheduled to reopen on the 6th of September. The request is that schools move to at least only in-classroom teaching on the 20th, but that if teaching can start virtually on the 6th, then they can proceed. But that in-classroom teaching is delayed for 2 weeks. Those, in essence, are the changes with respect to the regulations, which will be released later on today and will take effect from tomorrow off.
Yes, although I find me boy come calm today, boy. What? And because well say we have we boy where we want him. But now boy say coming back for the tail. Boy come calm, he come still. If you know what I mean, but in the ending he couldn't help himself. Jada. In the ending, my boy couldn't help himself. I like him too much. And I dog and I tell her put all the money in my partner business. You know what I mean? So yes. And so these are some of the changes that you can expect. All right. We also heard from Dr. Sean Charles. I tell you, favor. I tell you, no, dog. Yeah, son. And I said, the boy said nothing so. You know what I mean? Boy come calm and cool. You know what I mean? Boy might drink some coffee and things like that. You know what I mean? And the boy decide that. You know what I mean? And I'll take that. You know, take me blows like a man. So. Dr. Sean Charles now, he gave some very important information. In fact, he started off this morning giving the nation an idea of our current COVID-19 situation.
So, as of last night, as of 8:30 last night, we have a total of 105 active cases. Only 8 of those are travel related, and the rest, the other 97, are local cases. Yesterday, once again, we recorded a relatively large number of cases. We recorded 30 new cases of COVID-19. We currently have 5 persons in hospital, and up till yesterday, they were in stable condition. Our lab continued to receive, large numbers of samples. From the samples that were processed, 257 were processed yesterday, but that's not all. That wasn't all of the samples that were collected. There is an outstanding 120 samples that we are waiting results for, and those are from those that were collected yesterday only. So 257 we have results for. The remaining 120 we will have those results sometime during the course of the day. So we continue to have a large number of cases recorded.
Yes, and that is proving to be a challenge and, of course, as well, a concern for the Ministry of Health. The numbers now are coming from places that there were not positive cases before. That's one of the things that is new.
Now, in addition, we note that the places where the cases come from, the number of places have increased. So we now have cases from St. George, St. John, St. Andrew, St. David. All right, and when we receive the results that are pending, it is anticipated that every parish on the mainland, at least, will have cases. So far, we have had no reports from Kerry-Aku and Pitimatnik, but we continue to be vigilant. We continue to test. We continue to monitor. From the patterns that we are observing, it is evident that we have a degree of community spread.
That's another announcement that was made today by Dr. Sean Charles. I think that's the one that we were dreading the most, that there is community spread in Grenada. It's the first time that the ministry is making this announcement that Grenada now has community spread. Now, community spread means multiple people have been infected with a contagious disease in an area where people are not sure how or where they became infected.
From the patterns that we are observing, it is evident that we have a degree of community spread of COVID-19, albeit at low levels at this point in time, right? But we do have this type or this pattern of transmission at present. We are unable to link many of the cases to any defined cluster or to a traveler. Hence the reason why we have determined that this is where we are at present.
All right, and so that's a situation that we have to monitor. Having community spread means that this is kind of like a very, very, very bad thing. Yes, because it makes the contact tracing harder, more difficult. And then if you can't trace the contacts and if you can cut it off adequately, then you're just fighting a moving target. Yes? So, wow. Now, you might have seen videos circulating on social media, circulating on WhatsApp and so on, with a man who claimed that he had to pull out his hair. Well, his hair is short, but he said he had to pull out his hair with his bare hands. I'm like, whoa! You beat the lady with the super glue, or the one that put it in the Gorilla glue or whatever she put in her hair. You beat that one, because I don't know how you did that. The man said he ripped his hair off with his bare hands. His hair is like this short. Anyway, so he's accusing the ministry of misdiagnosing him. He's saying that they diagnosed him with COVID-19 and he had no COVID. They're experimenting on him. Yeah? So the ministry is responding. And the ministry says here that they stand by the protocols for the treatment and discharge from hospital of the COVID-19 patients. It goes on to say in a press release, responding to claims made in a series of videos circulating on social media and during an interview on some kind of program, I don't know, the Ministry of Health asserts that there are requisite protocols which are duly followed when a COVID-19 case is confirmed or present in the hospital environment. In keeping with the health protocols, persons testing positive for COVID-19 are isolated and tested for their presenting symptoms. Now, when the patient is sufficiently stable, the protocols provide for their discharge from hospital with advice to continue treatment at home and to self-isolate for a further 7 days. COVID-19 patients are therefore advised to ensure adherence to these guidelines to help prevent further spread of the virus. Health officials continue to monitor discharge to COVID-19 patients and will provide medical clearance at the appropriate time. The public is advised to avoid any physical contact with the person who known to have tested positive from COVID-19 for the duration of their illness. Further, the public is advised to follow all recommended COVID-19 protocols for their own safety. These include wearing of a mask or other facial covering when in public places, maintaining physical distance and avoid mass gathering, as well as frequently washing off or sanitizing of your hands. All right. They also say that they'll be dealing appropriately with the individual who they say probably might have breached the protocols as well. Okay, Olia, how are we looking? So we are moving on. The Pan American Health Organization, boy. Now earlier you heard that we were talking about the schools, right? So schools is going to be the reopening of schools will be happening no sooner than the 20th of September 2021. Now they are saying that they're looking into starting online classes on the 6th of September, if that is workable. But for now, if they are to go back physically, it's not going to happen sooner than the 20th of next month. Right? Now, the Pan American Health Organization is recommending that member countries adopt a phased approach to reopening schools for face-to-face learning in the 2021-2022 academic year in light of the novel coronavirus pandemic. Director Dr. Carissa Etienne says this approach should take into consideration the local epidemiological situation, which she notes can change rapidly. Surveillance will be key to ensuring that reopening is done safely and that learning environments remain safe, Dr. Etienne added while speaking during PAHO's COVID-19 digital briefing on Wednesday, August 25th. Dr. Etienne said prior to reopening schools, countries must ensure institutions can maintain COVID-19 prevention and infection control measures, including physical distancing, hand hygiene, and wearing of your masks. Noting that there is COVID-19 community transmission in almost every country, the director emphasized that what we do not want is for schools to be transformed into catalysts for more of this. All right, good. Also, we are learning from a study. They say that fatigue and shortness of breath still afflict many patients a year after their hospitalization for COVID-19. And they are saying that persons who contract COVID-19 can present some of these symptoms for as long as 1 year. Now, they are saying this because more time, as time elapses, still persons who were tested since last year and were positive are complaining that they are still experiencing some of the symptoms. You have another pandemic going on. And it's been there for a while and now again hard. Because to date, nobody seems to be interested in finding a cure for dotishness. Yes, dotishness. Because, you know, sometimes you look on the live or you look at the comment section on Facebook and so on, and the kind of thing people are, the kind of thing people have come up with, you wonder how it is authorities in taking a serious look into dotishness. Because it is an impediment to many things. Your belly hot, you get a tablet. It's only your belly that hurting. You understand? But you have big pharmaceutical companies making medications for belly hot. Although it's your belly alone that hurting. But when you hear somebody dotish, it sometimes can be transmitted to other people. When people dotish, it could be contagious. You understand? And they're laughing. Think for it to be serious. I don't joking about that. And in fact, when you hear I go in politics, it's one of the first things I'm doing. In addition to having another factories in Grenada, I want to make sure I see on the shelf a medication that says treat acute symptoms of dotishness. And I'm making sure one of my markets for selling is on social media, Facebook. No. Yeah. Sometimes I just read something there. I just read something. Oh, here only gain trouble someone. Why is that one? Sometimes I read something, but you know, you just have to condition your mind. Mikey, don't say nothing. Mikey, don't say nothing. Mikey, maintain your composure. Maintain your cool. And I know a lot of you just have to go through that every day. You know? You just have to maintain. You know? No. Well, that's like maintaining. It's more like herbal treatment for dotishness. But still, when herbal treatment don't work, you have to go to the pharmaceuticals. So again, we need medication for dotishness. You understand? And I could well see it in a very colorful, like a neon color. It must draw your eye. And listen, you have to put it by where the people cash in. You know what I mean? So you don't miss it. So if you notice, when you live in the pharmacy or the supermarket and things like that, in fact, and you don't need no prescription, you go know if you notice. And you live in and you go and pay, you realize, can I get a bottle? A large bottle. And the strong one. No. Anyway, Olia, let's move on now. Courts boy, St. Lucia, hit twice in one day. You know? Twice in one day. They say a man run. They say a man run with a weed that again medication for dotish. How you expect to thief a weed and nobody go? So what you thought? You go just grab a weed run out of them people's store and like what? And then tomorrow's and then you go when you hear we need medication for dotishness.
The Chaussee Road branch of Quartz Unicommer, a regional furniture and appliance retailer, was again targeted by thieves twice in the same day. The robberies happened hours apart during operating hours on August 26. The first known attempt involved at least one man who allegedly attempted to make off with a weed eater. He was caught by a team of bicycle police officers who were on patrol in the vicinity of the store at the time. The alleged weed eater thief supposedly entered the Chaussee Road branch through the main entrance and then grabbed the expensive landscaping device and dashed out of the store. Only a few hours later, multiple suspects stormed the same Chaussee Road store. Already traumatized customers and staff had no time to recover from the previous robbery attempt that occurred only hours earlier. Police believe at least 4 male suspects were involved in the second brazen holdup. Details emerging from robbery number 2 indicate Court's customers and staff were ordered by the armed bandits to lie on the ground and hand over their valuables. Cash, cell phones, and other personal effects were taken from the robbery victims. Commuters described the incident as a hostage situation that involved unsuspecting court staff and shoppers. The police force's Major Crimes Unit descended on the robbery scene after the suspects made good their getaway. Rehan Isidore, NBC Prime.
All right, and folks, yeah, somebody, Kirin, what a story that should be for. There is a current investigation happening in St. Lucia, and here's what they are saying, that with all of the robberies that have been taking place, they think that they have found the persons responsible. Because you know what happened? They just get comfortable. They just get comfortable, and then when they get comfortable, they make a simple mistake. And that mistake land them in real hot water. You understand? And so they are looking into that. Folks, don't forget, many of the stories that you hear here on the program, you can, after the program, you can check it out on our Facebook, on our website, mikeylive.com. All right? Good. Who are calling me there? Watch. Simone, let me tell you something. Simone, let me tell you something. Put it this way. The year when he get in trouble, boy, he long again, so you know, no. You understand? When you get in trouble, boy, you don't want to stand up. Let me tell you something. Let me teach you all a lesson, right? There will always be people who are jealous of your progress. There'll always be people who have problem with your success. Yes? But it really isn't personal. You don't take those things personal, because it's all about that person. Sometimes when I see people like that, I kind of like feel sorry for them, and I hope that I can, if there's anything that I could do to help people who are struggling with accepting other people's success, I will, because it is worse than a pain. Because when you have pain, is like you could take medication and so on, but when you have problem with yourself, there's nothing that could cushion that. There's no pill you can take. There's very little that you can do to fix that. Yeah? So whenever you see people come after you, Kirin, or whoever, I don't know. Whenever you see people come after you like that, when they don't know you, when you have no runnings to them, when you don't even know them, and sometimes they come with fake names, just know that these are people who are struggling within themselves, Kirin. They are struggling. And so they are left with going after others. Because they say, there's this old saying, misery likes company. And that's what it is like. So because they are unhappy with themselves, because they can't make it as well as you, because they got no flow, then they will come over to your property. They will come over to your space because they ain't have no space for themselves. They are so busy with others, minding other people's business and trying to pull down everybody else around them. They have no space for themselves. They have nothing working for them. So all they do is they go out there and go after Tom. They go after Dick. They go after Harry, right? They go after everyone. That's what they do because they are sad. They are miserable. They are unsuccessful. So the little that they have in them, the little energy that they have in them, instead of using it to do something productive, to be successful, or to work on something that makes sense, they take that time and they go after everyone. It's like, you know what does that? A platoon dog. You realize? A platoon would have a nice plate of food in front of it, but with behind every bit of breadcrumb that they see. And so while they're going after the breadcrumb, another dog just come and eat their food for them. So don't take it personal. Feel pity for these people, and trust me, if you can't help them in any way, go ahead and do so. That will be one less miserable person on the face of this earth. Okay? Good. So here's what we're going to do. We're going to take a break and come back. And when we come back, we've got the national report for you. And of course, we've got the weather. And if during that time we have any other breaking news for you, then we'll be able to give that to you as well. We're taking that break and come right back.
Running low on groceries? Why not visit realvalueiga.com and experience our new online shopping platform? Place your order, then go out and enjoy your day to spend more time with friends and family. Free delivery available within select locations or in-store pickup available. Sounds simple, right? It is. Stress less, live more with Real Value IGA online store, where good food begins.
Let's get tough on breed your larceny. It will destroy our economy. Larceny threatens our food security. Can hurt us locally, hurt us globally. To all the buyers, ask for license from all produce sellers. To all the people, 300 for police for them thieving fellas. To all the farmers, please don't steal produce from your brother. Then you're selling to traffickers, hotels and street vendors. Nah man, let's do all we can to stop breeder larceny. New vigilance, new laws, and a tough judiciary. Stop Grenada's organized business crime. It's time.
To report pre-deal larceny, call 300.
It's your summer everything loan from the communal. Borrow up to $10,000 for all your needs. School supplies, staycation, home renovations, appliances or furniture. You can have it all with a summer everything loan. With competitive interest rates and same-day approvals, you can't beat this loan special. Not a member? Join today to get onto this exciting offer. It's your summer everything loan from the communal. Apply today and take advantage of this exciting offer. Visit the nearest communal branch or call us at 440-1755 for more information. Lending terms and conditions apply.
After being locked down during the pandemic, get ready for summer with Rika. Live this summer with Rika's Summer in Every Drop promotion. Buy any Rika combo of 6 200ml, 4 330ml, or 3 1-liter Rika juices and get a chance to win. Win Apple AirPods, plunge pools, beach dress with umbrellas, barbecue grill set, gamer set, and weekly pop-up giveaways. With Rika, there's summer in every drop. Promotion ends August 31st. Tickets available at all leading retailers island-wide. Rika, distributed by Superb Distributors Inc., Tempe, St. George's.
Diamond Intercontinental Jewelry Store now has amazing deals, special discounted prices on wedding sets, watches, and selected jewelry. We sell top brand jewelry and watches like Citizen at the best price. We offer the best deals and customer service on the island. Opening hours Mondays to Saturdays, 9:30 a.m. to 5 p.m. Diamond Intercontinental Jewelry Store, located at the Esplanade Mall, St. George's, Grenada. Visit or call us today for 14-3114-232-1234 or WhatsApp 533-1581. Sale is on for a limited time only.
Are you prepared for the hurricane season? Do you have a plan? Remember, water is essential in any emergency plan. Determine your family's water needs. Ensure your storage containers are food grade and store at minimum 35 gallons of water per person per day for at least 1 week. Understand that your planning may be different this year because of the need to protect yourself and others from COVID-19. Take the necessary actions to ensure that your household has an adequate stored water supply should there be an interruption. Be prepared. Nawasa, committed to meeting customers' needs.
All right, and we are just receiving some news now that there seemed to be an accident on the H.A. Blaze Street. We have received multiple reports that one person died as a result of that incident. We have not been able to independently verify that information, but once we get off the program, we'll be able to do so for you. Again, we have received from multiple sources about this accident on H.A. Blaze Street. We have seen videos where police cordoned off the street. There are people who are very emotional on the scene, screaming and so on. And again, onlookers are there, the police are there, and they have cordoned off that particular area. that's as much information that we can share with you at this moment. And once we can get some more, maybe by then it might be too late, but I'll still try between the national report and the weather to see if there's more information that I can obtain on your behalf about this particular incident again. So we are receiving reports of an accident on the H.A. Street. Currently, the street is cordoned off, and there is someone who's lying on the ground who others report has died. But again, we do not have any facts on that. That is just what we've been told by the onlookers. And once we are able to get more solid details, then probably we'll be able to say definitively so. Probably you can continue to monitor our page. If we are not able to get the information as soon as we want it, then we will be able to post something on our page a little bit later on, so that you at least will know what has happened. All right, so that's what we have for now. We'll be back following the national report.
What does it take to be an amazing woman? Lots of me time. Amazing women are classy, fancy, and a little sassy. It's the drink for me. Cheers! Sometimes you've got to show them who's boss. Alpha male? Nah, alpha females are more amazing. Cheers to securing the bag. We make time for ourselves, for work, friends, and we certainly make time for passion. We're simply amazing. Amazing cream liqueur for the amazing woman in you.
Make this Carnival Tabanco sale a special one at Spice Isle Jewelry. Get up to 40% off our collection of silver and gold jewelry with purchases above $115. Visit our 2 locations on Grenville Street, St. George's and the Spiceland Mall Grand Dance and see our fine selection of traditional West Indian bangles, necklaces and earrings, rings and our unique handmade pieces. Step into Spice Isle Jewelry and shop in air-conditioned comfort with friendly, helpful and courteous staff. We also pay the most for scrap gold. Our repair service is second to none. Treat yourself or even someone special with something special from Spice Isle Jewelry. Call us on 440-3155 or 440-6648. Sale ends August 31st.
Hassle-free loans for your every need. Cards have you covered, best believe. Courts Ready Cash is for everyone. Not to worry, fast approval. Hurry up and come. We got it all, we on the go. Courts Ready Cash, you already know. We got it all, we on the go. Courts Ready Cash, always ready when you're ready, let's go.
Courts Ready Cash, ready when you are.
Welcome to Yogo. Most of you know us for our food delivery service and our food pass for free delivery from restaurants. But did you know you can also use us for grocery deliveries too? We've just added another 5,000 plus new items to Yogo's supermarket. And stay updated as we add more products and vendors. Yogo Services is our convenient skip the line offering. Let us pay your electric, water, and other utility bills for you. With us, you will be able to buy tickets, pay your rent, schedule bookings, and other services. Need a ride to get somewhere? Give Yogo Lyft a try. Select your pickup location and destination location and wait for our driver to collect you. Never have to worry about how you're gonna get to a place again. Please see website or app for our service locations. And sign up now.
Ministry of Health records another 29 COVID-19 cases, bringing the total confirmed cases to 295. We'll have details to this story and more in the national report. With the details to the news for Thursday, August 26, 2021, I am Chrisanne Mitchell. The Ministry of Health on Thursday confirmed an additional 29 COVID-19 cases in Grenada. The total number of active cases is now 105, the highest number recorded at any point during the pandemic. The majority of new cases continues to be Grenadians with no recent travel history. Only 4 imported cases have been identified among the new positive cases. They were picked up through routine entry protocols and remain in quarantine. Health officials have confirmed that the majority of persons testing positive are exhibiting mild or no symptoms. The most common symptoms recorded among positive cases are body aches, fever, sore throat, congestion, and headaches. 5 persons are currently hospitalized, all of whom, through the efforts of the medical team, remain in stable condition. The Ministry of Health continues to advise persons who may have been exposed to a positive case to immediately isolate at home, contact the COVID-19 hotline at 458-4787, 538-4787, or the nearest medical facility and await testing. Persons are strongly advised not to use public transportation or to visit the hospital or medical centers, as these actions will put additional persons at risk of contracting the disease. In follow-up to the identification.
All right, so folks, what it seems like I don't know. Haven't you guys heard? I'm looking at the beginning of the national report tonight, and it looks very similar to last night. So I'm wondering if somehow they might have sent us the wrong thing. It does have yesterday's date on it, today's date on it, so that might just be an error in the file that was sent to us a moment ago. All right, so we'll have to backtrack on this one for now. All right, let's take a look at the weather and see what's happening with the weather. And we should be so I'm getting the new national report now. It's just about 20 or so seconds away, and that's the next thing. As I was telling you guys from Digital, the service is so fast that even large files we are able to download in a few seconds. Again, we have received names and so on about the person who is involved in the incident. It seemed like there's a biker, and it may just be not a private vehicle that was involved. It might be, well, let me not say anything as yet. Let me keep that piece for, we try to be as responsible as possible. But what we can tell you is it has to do with a biker, all right? And he might have collided with a vehicle on it. But that's a one-way street, no? Yeah, HA Street is a one-way street. So the vehicles have to be going in the same direction. Yeah. Okay. No, that's interesting. So then it wouldn't be a head-on collision. It can't, unless, well, somebody's driving in the wrong direction. But HA Street is a one-way street. So let's get organized. Okay. So let's get organized with the national report, and then behind the scenes, I'll try to see if I can get some more information for you. All right. Okay, so we are getting names and also confirmation from other sources, but the only confirmation that we accept as credible, well, is the authorities. So even if there are some that are saying that it is confirmed, I have a colleague on the scene right now who is saying it's the death is confirmed or whatever. We can't say that until there are persons who are qualified to so do, and that is usually a health expert or someone of the sort. All right, and again, that is an incident that has happened on HA Street. Well, it's a fluid situation. It's happening right now where they say that there's a biker on the ground. He's motionless. There's a police vehicle there. I'm not sure if the police vehicle is part of the incident, so I can at least report that. So there's a police vehicle on the scene. The area is cordoned off, and the biker is still on the ground. I received the first notice about that about 10, 15 minutes ago, and still what my colleague has just said is nothing has changed in terms of the person being on the ground. So, all right, at least we can report that. Now, let's take a look at the weather, and then from the weather, we will get into the national report. I think we should do that, all right? Okay, so that will be the public forecast. And by the way, speaking of public forecast, we've been getting a lot of rain lately, boy. Well, in St. David, where I am, we've been getting a lot of rain. So I don't know about your area, but it's probably good for the farmers, right? Good for the farmers. I don't want this. I'm looking for a more thorough update from you. A lot of these updates, by the way, they come while the program is happening. Yes? So they are fresh information. Here now is the public focus for tonight. Partly cloudy with brief light to moderate isolated showers. Now tonight's minimum temperature is expected to be about 25 degrees Celsius. Winds northeasterly to easterly at 10 to 20 miles per hour, becoming variable to calmer times. Seas are slight to moderate, waves up to 6 feet in open waters. And that's for tonight into tomorrow morning. Now let's take a look at the weather for Saturday. Now for Saturday, the weather is expected to be mostly fair at first and hazy, becoming partly cloudy with occasional light to moderate showers. Winds east-northeasterly to east-southeasterly at 13 to 23 miles per hour, gusting higher at times. Seas are moderate to slightly rough, waves up to 7 feet in open waters. And what's the next thing that we have to tell, Ollie boy? The next thing that we have to tell, I don't know, are you guys interested in knowing for the next day as well? Okay, so Sunday, partly cloudy and hazy with light to moderate showers and a low chance of isolated nighttime thunder. For Sunday, your maximum temperature is expected to be about 30 degrees Celsius, let's say 30.5 degrees Celsius, and your minimum 23.5 degrees Celsius, which is pretty decent. Winds east-northeasterly to east-southeasterly at 12 to 22 miles per hour, gusting higher in showers. Seas are moderate, waves up to 7 feet in open waters, and a small craft advisory is in effect for Sunday. And Monday, well, for Monday, you can expect partly cloudy to cloudy and windy conditions accompanied by light to moderate showers which may become heavy at times with a low chance of thunder, improving as the evening progresses. We've got the max temperature 29.5 degrees Celsius and minimum 23.5 degrees, pretty decent temperatures, really cool. Winds east-northeasterly to east-southeasterly at 14 to 24 miles per hour. That's pretty windy. And gusting higher in showers. Seas moderate, waves up to 7 feet in open water. So you got tonight's weather, you got Saturday's, Sunday, and again, you can have an appreciation for what will happen on Monday. All right, and folks, what else do I have to tell you? I want to make sure, the national report will be the last thing that we do. We are getting more footage, and we will not be able to share with you the footage, because, no, papa. No, sir. Let's leave that alone. Okay? No footage. All right, so you'll get me on GIS, or you'll get away for giving me a wrong thing tonight. Anyway, so here now is your national report, and when we come back, we just pick up a few people, and then we'll call it a night. All right?
Ministry of Health says continued rise in COVID-19 cases points to community spread. We'll have details to this story and more in the national report. With the details to the news for Friday, August 27th, I am Rikisha St. Louis. The Ministry of Health has confirmed community spread of COVID-19 in Grenada. Acting Chief Medical Officer Dr. Sean Charles said Friday that the patterns emerging from the current spike in COVID-19 cases point to community spread. Prior to this, Grenada recorded specific clusters of positive cases, which were either directly linked to an imported case or a traced contact of a confirmed case.
In addition, we note that the places where the cases come from, the number of places have increased. So we now have cases from St. George, St. John, St. Andrew, St. David. All right, and when we receive the results that are pending, it is anticipated that every parish on the mainland, at least, will have cases. So far, we have had no reports from Kerriku and Pitimatnik, but we continue to be vigilant. We continue to test. We continue to monitor. From the patterns that we are observing, it is evident that we have a degree of community spread of COVID-19, albeit at low levels at this point in time, right? But we do have we do have this type or this pattern of transmission at present. We are unable to link many of the cases to any defined cluster or to a traveler. Hence the reason why we have determined that this is where we are at present.
Infected persons range in age from 4 to 71, and at present, there are more female positive cases than male. Additionally, the vast majority of positive cases are unvaccinated persons, many of whom are exhibiting mild symptoms. Dr. Charles explained that infected persons usually develop symptoms within 2 to 14 days of exposure. Therefore, there should be no rush to test immediately after exposure, as this could lead to a false positive. He further stated that based on the incubation period for the virus, testing is typically done between 5 and 7 days after exposure.
The symptoms that persons may develop may include fever and chills, or fever with shivering, cough, shortness of breath. Now, these were the classic presentations of the disease. What we are noting particularly is that persons are presenting with muscle and body aches, headache, fever, runny nose, congestion, sore throat. Some persons present with upset stomach or nausea, vomiting, and diarrhea. These are common symptoms of this disease that we are seeing in the population. So anyone displaying these symptoms, all right, it is highly likely that you have COVID-19, and you need to take the appropriate steps to ensure that you do not spread this infection to your family and your friends and your workmates alike.
The public is reminded that there is no cost for COVID-19 testing conducted as part of measures to manage the public health crisis. Persons who have been exposed to the virus should call the COVID-19 hotline at 538-4787 or 458-4787 or contact their nearest health center. The government of Grenada is making additional changes to the COVID-19 regulations following a cabinet meeting on Thursday. Health and Social Security Minister Honorable Nicholas Steele outlined the changes during a press conference on Friday, explaining that the changes are in addition to those announced by Prime Minister Dr. the Right Honorable Keith Mitchell a week ago during his national address, which includes no party-like activity, including but not limited to bus tours, private parties, beach parties, and other forms of public entertainment, and no amplified music. The changes, which become effective at midnight, include a 1-hour limit on funerals, which must now be held between 9 a.m. and noon, and a delay in the reopening of schools for in-classroom teaching.
Restaurants and bars shall move to takeout service only with effect from Saturday, that is tomorrow, with effect from Saturday. Churches are asked to maintain the 6-foot distancing throughout all of their services and gatherings. Similarly, funerals will be between the hours of 9 a.m. and 12 p.m. and should not be longer than 1 hour. Schools, which were scheduled to reopen on the 6th of September, the request is that schools move to at least only in-classroom teaching on the 20th, but that if teaching can start virtually on the 6th, then they can proceed. But that in-classroom teaching is delayed for 2 weeks. Those, in essence, are the changes with respect to the regulations, which will be released later on today and will take effect from tomorrow or from midnight.
Minister Steele explained that the intention is to restrict movement and get control of the situation to prevent a further spread of the virus without having to resort to a national lockdown.
Always the balance to shut down and then to reopen in a couple of weeks to come back with the same activities or so to create a spread again, to shut down again. I truly do hope that it does not necessitate this time around a complete lockdown as we're seeing in other countries, but that we can restrict it, get control of it without that happening. We are starting from a situation that is much more difficult this time around. In the past, when we did have outbreaks, if you remember, one of the first ones was an individual who went to multiple establishments. And so there was a risk that at each of those establishments that he went to, he had breached his quarantine and went to multiple establishments. But we were able to go to each and every establishment and get a list of everyone who was there when he was there, and then communicate to them, have them isolate, test, and therefore get control of the situation. In this instance, we're dealing with, over the last couple of weeks, events that had no record of who was there. So Dr. Sean and his team are relying on persons' memory of who they saw close to in the crowd or so, of persons coming forward and saying, I was there, therefore I'd like to get tested. And also the difficulty of other persons not coming forward and hoping that maybe they had dodged a bullet or so. So it's a very difficult situation this time around.
I'm a skillful electrician. I love to work and I cannot work.
The words of Augustine Pear, a resident of Adelphi, St. Andrew, who is still grappling with the effects of COVID-19 a year after recovery. Pear was a respected and skilled electrician with one of the country's leading electrical companies in the south of the island. In 2019, he left Grenada on an 8-week trip to the United States to visit his mother, who was severely ill. Mr. Pear broke down as he relived the 7 months he spent lying on his back.
The COVID took me up there. It caused me to go in the hospital. I spent about 2 weeks there unconscious. I don't know when I'm going to the hospital. I was unconscious, and I spent 7 months because he had like a problem to come back, with this flight and so on. I spent 7 months just lying down, cannot do nothing in America. And it was very frustrating for me. It is something dangerous. Right about now, I cannot walk again. It damaged all my hands and my feet. And I'm just struggling with it. Trying to do a little exercise now and again, to keep my body fit, but I cannot walk again.
He is calling on Grenadians to take things seriously and protect themselves. His hope is that no one has to experience what he lived through last year.
I was passing feces and things of myself. It was very embarrassing, but I did went through a lot. Wow. And my prayer is that people should do what they have to do because this thing is very dangerous.
This is the National Report. The news will continue after the break.
This is a message from the Ministry of Health. If you or a family member suspect that you may have contracted COVID-19 and are displaying symptoms, please immediately self-isolate at home. This means that you must also avoid all contact with other members of your household. Do not visit hospitals or health centers, as this creates the potential for further spread of the virus, and it puts additional persons at risk when you come into contact with them. Your best course of action is to call the COVID-19 hotline at 458-4787 or 538-4787, or contact your nearest health center or medical station. Once your information has been received, health officials will come to you. Help prevent the spread of COVID-19. This has been a message from the Ministry of Health.
Welcome back. More than 1,400 Grenadians opted for the Pfizer vaccine during its first week of distribution as part of the Ministry of Health COVID-19 National Vaccination Campaign. Starting on Monday, August 23rd, the Ministry of Health included Pfizer as a vaccine option, and by Thursday, 1,350 doses were administered to Grenadians at the various vaccination centers, health facilities, and pop-up clinics island-wide. This figure does not include doses administered today, Friday, August 27th, at pop-up clinics and the National Stadium. Grenada recently received a shipment of 29,250 doses of Pfizer vaccine from the United States government, providing an alternative to the AstraZeneca vaccine, which is the other option being used locally. The Pfizer vaccine is available to children 12 years and older, and therefore expands the section of the population that is now eligible to be vaccinated. The ministry reminds persons interested in the Pfizer vaccine that it will only be administered by appointments in groups of 5. So far, over 24,000 individuals received the first dose of the vaccine, and over 18,000 received the second dose, which includes both the AstraZeneca and the Pfizer vaccines. Finally, in the news, the Ministry of Health is advising persons who believe that they have been exposed or have come in contact with someone who has tested positive to avoid interaction with other individuals. Acting Chief Medical Officer Dr. Sean Charles said persons should remain at home and contact the COVID-19 hotline at 538-4787 or 458-4787 or the nearest health center so that testing can be done. Self-isolation, he said, is one way to prevent the spread of the virus. During a press conference on Friday, the CMO said more communities throughout the island have been identified for the presence of positive COVID-19 cases. Grenada's status has changed from a cluster of COVID-19 cases to community spread, which means infections are now being detected on a wider scale, with the source or origin likely to be unknown.
The only way we can stop transmission is to stop this disease from hopping from person to person. And that happens when someone who is infected goes out in public and mingles with other individuals who are susceptible. And this is how the disease is facilitated. So if you are sick and you get on a public bus, and we know the level of mask wearing that is occurring out there, we know that there are individuals still that are reluctant to adopt these simple behaviors to prevent the spread of this disease. So if an infected individual goes in public, uses public transportation, shares the same space with uninfected individuals, they can spread the disease to those individuals. And those individuals, in turn, will spread it to their families and to others that they come in contact with. All right? This is how the disease is able to hop from person to person. We can stop this if we stop that kind of movement.
That story just ended the national report for Friday, August 27th. Recapping the top story. Ministry of Health says continued rise in COVID-19 cases points to community spread. On behalf of the entire news and production team, I am Rakisha St. Louis saying thank you for joining us. Until next time.
Thank you very much. And that's it right there. And so what's next for us, boy? Just to big up a few people on the program now. Cynthia, Zaka, Kireen, Shireen, Joyous, Kathy, Suzette, Ezran, Celine, Mikey, how is it too? How you know about me too? Shireen, how you know about me too? Who tell you? Who tell you? People too fast. The toe coming along, man. How you know about it too? Did I say anything about it too? I can't remember. Anyway. Java, me too good. Glenda, Wendy Ann, Miriam. Oh, I told you all about it too. Yeah, boy, I told Jan. No. Yeah, boy, I told. Yeah, that you see, Vicky, you see that's what going on with the head, eh? Listen, the amount of things that head us have to deal with on a daily basis. Sometimes something happened in the morning, and by the time the afternoon time, I wonder if that happened last week, you know? You understand? Because when I had to go back in the memories, far as I had to go. Serious. Marlene, Lauren, Olive, a block. I blocked the I know who's there. I think I have enough suspicion of who's there, who come in with fake name and thing. So while it was on the national report, I say, you know what? Let me be a little petty. Let me be petty for a little while. I go and block. So guess what? You know, like some people don't think, right? Okay, so you get blocked. That means you can't come back. It's bye-bye for you. Yeah, that's what I'm saying. Like, you can't come back. So if you want to, it's like this. If you want to defeat somebody, why would you show yourself? Wouldn't you hide in the bushes or something and nibble at them and try to find ways of kind of like diminishing them and things? But when you gonna show yourself, you know what I mean? It's like them people, you know, you watch the movies when they see people think they're bad and they come in front of you and they go whoop whoop and they give you all kind of confirm, they do all kind of thing and you just stand up and just watch them and just go boop. One blow and they're done. Yeah, Hassan. I say, you know what? I'm gonna block them. Block them. They can't come back. Ventress. Bermuda, Nikki. Della. Oh God, Nikki. You know, Darwin, Atalia, Margaret. Who else is there? And everybody else. So take care of all yourself, all right? And then we will touch base again. Rolanda. I say, you know what? You understand? So now they can't get to see nothing. They can't come. They can't make noise. They can't get to see, even if they're genuinely interested in the news. Yeah, and you know, there are other things like things that we just have on the page, like other breaking news, press conferences, all of that. None of that. They can't see none of that. None of that. You understand? So if you're not important to them, why they you know what I mean? So you don't need that. You know, just block. You don't need that. Go somewhere else. Oh, God. She didn't say they come back with another profile. Well, block again. No, but Facebook is really intelligent. Huh? So, for example, so if Facebook would know the IP address and all of that of where the person came from, right? So if they're trying to come back, Facebook would know that, all right? I mean, sometimes there are little ways of getting around it, you know, but, well, they get blocked again. And why would they be, by then, why would they be trying so hard to get in, you know? It's like you're trying to get into a party that nobody wants you in. Yeah, I mean, as soon as you come to the security put you out, you come back. Well, you can hear, we don't want you there. We don't want you here. You understand? So they'll stop trying because it's so easy to block. It's a lot to get in, but it's so easy to get out. So it's up to them to try, eh? But let's be petty for now, eh, Cynthia? Mikey, if you block me, I know where you're working. I'm coming for you. Well, come now. Just bring a Coke when you come in. Make sure you're cool. Anyway, Kirin and all you, take care. Andrea, blessings and all about you. Vicky, blessings. And just know that I love and appreciate you guys. Prudencia, Java, just know that I really appreciate you guys. I love you. I would do anything to make sure that you guys are okay. If somebody coming behind all you are coming, they have to go to me. Yeah, so, watch. If they coming behind all you, they have to come to me first. You understand? They have me to do it. Yeah, I mean, so yeah. Take care of yourself, all right? Be safe, all right, guys? Oh, God, we say we're going to be here for how much minutes? For 20 minutes? We are on 20 minutes and going. Anyway, I'll go out of the home. Take care. Your coffee, go out of the home. All right? Next thing, police knocking we do. What are you doing outside? Anyway, take care, guys, and we'll touch base again, all right? Let's go. In 5, 4, 3, 2, 1, we all say, ja! No, take care.